Hey guys, so I just got back from a job fair and I am completely overwhelmed with so many positive emotions right now. I just wanted to put them out there in the world. So little backstory, ever since I graduated nursing school, and also this has kind of been my goal even in the RN program, I've always wanted to go to my mom's hospital. And I know maybe that may sound like a weird goal to have. The reasons being to that is because my mom has been there for almost 17 years now. She has thrived in it. The hospital she works at is a union, so they have great benefits and great pay, and it's also certified for so many things, like it's a stroke center, chest pain. Actually, where's my paper? It's accredited as a chest pain center, and it's the first hospital in this region. It's a top performer and distinction for heart attack, pneumonia, surgery, and heart failure. Designated as a Blue Distinction Center for Spine Surgery. It's the first designated stroke center in my county, the only designated joint replacement center in this county. It has quality respiratory care recognition, and it is a level 2 verified trauma center in the region. So those are some of the accreditations of this place. I was a little hesitant on going. My mom pushed me to go to it because I was hesitant because on the job flyer it clearly says for experienced nurses only. It boasts like up to a 20K sign-on bonus, which is insane, but I just went anyway to kind of see what it was all about, maybe even get my name in there, because I had already applied to their new grad program just a few days ago. So I was essentially just kind of waiting for the world to happen and to possibly get an email from them. And when I got there, I actually was able to speak to and meet my recruitment officer, who I had spoken to earlier, like last year, but nothing had happened at that time because I hadn't passed the NCLEX yet. So I was able to finally meet her in person. She recommended me to look at all the floors, which they had everything there as a job fair would have for each department. I focused solely on the med-surg floors, which my mom is not a med-surg nurse, so being a new grad, I'm just drawn to having a med-surg experience as well, because in all honesty, I don't know which specialty I truly would love to specialize in someday. All I do know from experience is that during my clinicals and during the nursing program, I fell in love with labor and delivery, which was never on the map for me ever until clinicals. It was not even something I considered at all. So although that is what I am interested in someday, everyone in general, you know, they always say nurses should have a med-surg experience as a good foundation first, right? I know that may not be completely correct nowadays, like who has the time for that, but I agree with it. The way that I think is very fast-paced, and I kind of just, I need that stimulation and that overall feel for all the floor, for everything. And since med-surg is kind of where all the patients with diseases that they don't know where to put them in, am I making sense? Med-surg is the floor where everyone kind of just gets dumped into it, so you see everything, and I am completely interested in that. Also telemetry, so I am pretty much interested in getting into a med-surg cardiac telemetry floor, for the time being at least. I completely went off on a tangent. Let's get back to the story. I get to the job fair and immediately it's just very welcoming, friendly. I see that a couple of them notice who I am because of my mom, and I filled out a paper, and one of the people there, one of the nurses, asked me if I could stay for an interview. and I hadn't prepared for an interview, although I kind of in my mind I was thinking like, oh, maybe there will be an interview, but just from seeing or just from hearing experiences of other people going to job fairs saying that it's more like a information center of different careers or jobs, I didn't expect it 100% that I was going to be interviewed, but I was prepared. Had my little portfolio, I had my resume and references in here. So I get pulled in for the interview. It is a panel interview. I was sitting with 5 people and it was quite short of an interview, surprisingly. They asked me to explain what I've been doing as a nurse thus far. Since they saw on my resume I had some experience as an LVN, and they asked me why would you want to upgrade to acute care. And then the question that threw me for a loop was, tell me about a time you had a conflict with a boss and they did something that you didn't agree with, and how did you handle that? And I completely froze. I took a few deep breaths. I was just kind of like thinking, because I didn't prepare for that type of question, and bam, I thought about the IV story that I kind of explained in my previous video. But anyway, they asked me what's a common misconception that people may have about you, and my answer for that just automatically was, I'm young, which is a common misconception I get so many times, at least once a week at work, where I get a comment that I am too young to be a nurse. Am I really a nurse? Did I really go to school? So that's something I was able to talk about, and I think that was pretty much all the questions. A lot of it was just talking back and forth, and it felt very comfortable despite how, you know, nervous I was inside, but I just kept smiling. I was very positive, and they took me out of the room. And a few minutes later, they took me back in and they said, congratulations, you passed the director interview. So I had passed the directors of each department interview, and they told me in about a month I will be getting a peer interview, which I asked my mom about what it was, and she said that I was going to be interviewed by most likely new-ish nurses or the nurses from that floor that I would be assigned to. So all I have to do is pass the peer interview, and I will be starting the new grad program in July, which is all I want. I feel now that I know that there is another interview, I can be prepared for it, and they were just so kind, and I don't know, I just didn't expect to be interviewed like that, but yeah, that was pretty much my experience. And I pretty much looked like this, except my hair was in a really nice tight braid, and I had a blazer, and I'm wearing, you know, some dress pants. So the skin tone variance between my face and my body is crazy. That's the update with that. Of course, I will be letting you guys know how it goes with the second and final interview, but hopefully I get it. Just fingers crossed. I need to just, I don't know, I just want this so bad, and I just need to maybe practice the law of attraction with this, because I've kind of lost a bit of that whole mentality. I've been very busy, haven't had time to really do a lot of yoga or meditation, and you know, I feel a little frazzled in my head. So my heart's like pumping. I'm just overwhelmed with so many positive emotions about all of this. But anyway, thanks for watching, guys, and I will see you guys in the next video.